Hi everyone, and welcome back to the One-Eyed Cooking Guy. This, as you can see, is part 2 of my informational videos about ocular melanoma. If you missed part 1, I have it linked down below in the comments for you so you can get caught up there. In this video, I'm going to talk about the variety of treatments there are after diagnosis and also talk a little bit about the different classifications that some of these cancer tumors carry and what that means for ocular melanoma patients. The first method of treatment to talk about is one that has several different names. You can see one here at the top of the graphic. It's also called brachytherapy or plaque treatment, plaque therapy. What it is you can see down in the lower right-hand corner, radioactive pellets, little seeds, are placed into a teeny little metal casing that's called a plaque, and the surgeon sews that teeny little metal casing just above the tumor on the eyeball and lets it stay there for several days. And while it's there, the hope is that the radiation from those pellets will focus in on that tumor and kill it. Then the plaque is removed. The good news is this seems to be pretty effective for lots of small tumors. The bad news is many people that have this sort of radiation treatment end up with a whole host of side effects from the radiation. And so there are people who just have mild discomfort in their eye all the way up to people who lose their vision completely due to radiation side effects. So it can have a downside as well. A second type of treatment for ocular melanoma tumors is called proton beam therapy. And as you can see from this picture here, this involves the patient sitting very still and a very pinpoint specific laser beam being shot into their eye over a few sessions and targeting just the tumor in the eyeball. So the hope is that that laser is going to go in, only hit the cells in the tumor, kill them off, and prevent that tumor from growing and from those cells from going anywhere else in your body. As you can imagine, this works really well for very small tumors also because it's just a pinpoint laser. It's very easy to specifically target a tumor. A larger tumor, you would have to move that laser beam around and potentially miss the areas in between. So this works pretty well for smaller tumors. Just like with the radiation I talked about before, though, many patients who have proton beam therapy end up with vision issues later in life, a whole range of them from mild to losing sight in their eye. And just like with radiation, I have met people with proton beam therapy who, for some reason, even though the doctor said their tumor was dead, their tumor comes back and begins to grow again in their eye. A third treatment option for ocular melanoma tumors is called enucleation. Enucleation is basically the removal of the eyeball, the severing of the optic nerve. It's usually reserved for tumors that are too large for the other two treatments I just described to work. This is the treatment I had. My tumor was really large. My doctors told me that those specific targeted therapies that I just described were not going to do a good enough job killing off the entire tumor, and that really the only option was to have my eyeball removed. I've met people who have had the other two treatments and then later on ended up with enucleation because those treatments worked for a while and then their tumors started growing back. And I've also met people who had those other two treatments who ended up having enucleation because the side effects from those other two treatments had just gotten so miserable for them that it was better to just lose the sight on that side than to have to deal with all the miserable side effects some people have to deal with. So people have enucleation for different reasons. Instead of showing you gross surgery pictures of it all, I chose to show you this picture of me. This is me just about ready to be wheeled in for my enucleation surgery. And I can laugh about it now, although on that morning I was not feeling very jokey. My biggest stress that morning was that they were going to remove the wrong eyeball and I was going to wake up blind. And so that's why you see there's the pen mark above my eye. I made sure the staff marked impermanent marker, which eye was the one that was supposed to be removed. It's funny to me now, so I can laugh at it now. But once that eyeball has been removed, the good news is that that tumor, as long as it hasn't spread to other parts of the eye socket, that tumor is gone and you don't have to worry about that tumor. In a future video, I'm going to be talking about the fact, though, that does not mean that your risk for cancer spreading is gone. I found this diagram and I thought it did a good non-gross job of explaining a little bit more about enucleation. So as I just mentioned, the eyeball is taken out. The optic nerve is severed right above here. You can see that on the diagram. And then in place of the eyeball, the surgeon puts in an implant. It's a round ball-shaped implant. And my surgeon tells me that mine is made out of a substance that's very similar to coral. It's not coral, but it acts like coral. And what the surgeon does is put that implant into the empty space in the eye socket and then surgically attach all of the muscles that used to be attached to my regular eyeball are now attached to that implant. And then after the surgery finishes, the surgeon puts something up in the front of your eyeball called a conformer. It's a big plastic disc that's made out of very flexible plastic. It's clear plastic. And basically, that conformer is there as you heal from your surgery to keep your eye open, to fill in the space so that your eye socket doesn't start collapsing on itself and the lids don't start drooping. As you heal from your surgery, which usually takes about 6 to 8 weeks and the swelling goes down, eventually that plastic conformer is taken out and many people get fitted for a prosthetic eye. Back in the old days, they used to call them glass eyes. They are not glass eyes anymore. They're not even round because, as you can see from this diagram, a round prosthetic eye would not fit in my eye socket because I already have an implant in there. So if you look all the way over to the left side of this diagram, you'll see what a prosthetic eye looks like. I'm going to do more about that in different video and talk to you a little bit more about prosthetic eyes and my process for getting mine. But the prosthetic eye fits over the front, kind of like a giant contact lens, and it fits in our lids. So it just gives you an idea sort of what enucleation looks like afterwards. It sounds like a pretty horrific surgery. It was not fun, but I was actually pretty surprised how I could be up and around and back to teaching. After about 4 weeks, I was full-time back teaching with all my cool eye patches on. And then about 4 or 6 weeks later after that, I got fitted for my prosthetic. So sounds like a terrible thing, and it is, and cancer is no fun, but I was surprised at how quickly I rebounded from the surgery. Those are the 3 most common treatments. I'm sure there are others, but as part of all 3 of those treatments, many patients opt to have their tumors biopsied so they can know the genetic information contained there. And the laboratories where those biopsies get sent have set up 3 different classes of ocular melanoma tumors. There's class 1A, class 1B, and class 2. If you're class 1A, you have the lowest risk for that tumor metastasizing somewhere else in your body at a later date. If you're class 1B, you have an elevated risk of that happening. And if you're class 2, you have the highest risk of that happening. So many people go for a biopsy so that they can have that information. That information helps inform scan protocols, which we'll talk about in the next video. And it also helps people, if you do metastasize, it helps people qualify for different trials to know what class their tumor is. Another part that plays into the biopsy is a substance called PRAME. All caps, it's an acronym for a long chemical compound. And I have done a lot of reading on PRAME and I still don't 100% understand what it is. But what it means is if your biopsy comes back PRAME positive, then that elevates your risk for metastasis at a later date. And if it comes back PRAME negative, that puts you at a lower risk. So when you put the class status along with the PRAME status, you can see there are a lot of different combinations and a lot of different ways that we can feel anxious about our cancer potentially coming back in another part of our body one day. So that's a little information on this video about treatment of ocular melanoma tumors and biopsy and classification of those tumors. Again, I'm going to repeat that I am not a doctor. I am not a medical professional. So if you find yourself with any eye issues, blurry vision, flashing lights, restricted vision, pain in your eye, please go see a professional. Go get your eyes checked. And I'm going to say this in every instructional video that I make on this site, is to please always go get regular eye exams and always request dilation with those eye exams so that the doctor can see the maximum area of your eyeball during those exams. I will be back with a 3rd part to talk about this scary machine here and what it means for ocular melanoma patients. But until then, I will see you soon.